Paul is a 39-year-old Caucasian male who came to our primary clinic for an acute care visit. Paul, what brings you here today?
God, I feel terrible. I have this runny nose, my face hurts, I'm heavily congested, I have this cough, and I can't smell things anymore. I checked my temperature yesterday, it was like 39.2.
Okay. So when did all the symptoms start, Paul?
It was about 2 weeks ago. I started having a bad cold and a runny nose.
Okay.
Yeah.
So you mentioned about a runny nose. Can you tell me the color of your nasal discharge?
Yeah, it was clear first, and then lately it's been yellow.
Okay. Do you think the symptoms are getting better or worse, or it stays the same?
Definitely worse.
Okay. Now, you mentioned several complaints, okay? What is your single worst symptom that you're having?
The worst is that my sinus hurts.
Okay. Now, what makes the sinus pain worse?
Usually if I cough or sneeze,
Okay.
then it's worse. Yeah.
What does it feel like when you're having that pain?
Probably like a toothache.
Okay. Can you point to me where the pain is?
Yeah, it's like around here and up here.
Okay. All right. Does the pain spread?
Yeah, at first it was like on the right side of my face, and then it spread to the left. So, yeah, it spread.
Have you had any sinus pain in the past?
Yes, usually like when it starts getting cold, like
Okay.
then I usually start getting a little bit of this.
How would you compare the pain that you have now from all the previous sinus pain that you've had?
I'd say this is definitely worse.
Okay, all right. So on the scale of 1 to 10, how would you rate this pain? 0 is no pain,
Okay.
and 10 is the worst possible pain.
Probably 7, maybe even 8. This one, yeah.
This sinus pain, when did it start? I know your symptoms all started.
Yeah, like
2 weeks
this about 6 days ago.
Mhm.
It seemed like it was getting better, but then it hasn't been. It's been getting worse. So.
Is it an ongoing pain, constant pain, or does it come and go?
It's constant.
Okay. Have you found anything that makes it better? For example, rest. Is it better in the morning? Is it better in the evening?
No, I mean it's just there all the time.
Okay. Can you perform your usual activities at home or at work?
Yeah, I mean for the most part, but it does kind of. I mean it's always there. It's kind of like a distraction a little bit having this. So.
Okay. Have you tried any home remedies? Have you tried over-the-counter medications? Or have you used any antibiotic?
No, not antibiotic. I used Theraflu. So
Okay.
yeah, I bought that and I used it.
Did you see or talk to any doctor
No.
about this?
Maybe the first one.
Okay. Any severe headache?
No.
Okay. Any changes with your vision?
No.
Okay. Do you feel any swelling around your eyes? Okay. Are you able to think clearly as you normally do?
Mm-hmm.
Okay. Any pain around your mouth or like a toothache?
No.
Okay. Any neck pain?
No.
Okay. Any nosebleeds?
No.
Okay. Any phlegm?
Yeah, I when I cough, I do cough up phlegm.
Mhm.
Yes.
What is the color?
It's yellow.
Okay. Do you see any blood when you spit?
No, I haven't
Okay.
seen anything.
Any difficulty with your breathing?
No.
Okay. Any chest pain?
Nope.
Okay. Any problem with your stomach lately? For example, when I say a problem with your stomach, like I'm talking about, do you feel nauseous? Do you feel nauseous?
No.
Okay. Do you feel like throwing up? Okay. Any constipation?
No, I haven't
Okay.
been constipated.
Okay. Any diarrhea? Okay.
No, none of that.
Okay, so you're going to the bathroom regularly with that. Okay.
Yeah.
Now, is there any changes in the amount of times you go to the bathroom in a day?
No, not really.
Okay. Any blood in the urine that you notice? Okay. Do you notice any rashes, sores, bump somewhere in your body? Okay. Have you gained weight lately?
Not particularly, no.
Okay. Have you lost weight lately? Okay. Have you felt unusually tired or sleepy lately?
No, not really.
Okay. So you're eating well?
No, I have lost a little bit of my appetite, and I think it's probably due to this. I haven't been, just lately I haven't been eating as much, so, yeah.
Okay. All right. Okay, thank you, Paul.
Okay.
Moving now to the physical exam. Looking at the eyes, I will inspect the eyes, observing for any periorbital swelling, allergic shiners, which are dark circles under the eyes, which indicates allergic rhinitis. I'm observing for any signs of tearing, any signs of orbital cellulitis, which includes conjunctival edema and drooping of the lid. It is very important to identify this immediately because a delay in the diagnosis of orbital cellulitis can lead to blindness and intracranial sepsis. The lids are firm. The upper lid margin rests at the superior border of the iris, and the lower lid margin rests at the inferior border of the iris, which tells me that the palpebral fissure is of normal size. Paul, can you blink your eyes? Lids close in unison with blinking, covering the entire eye. I'm looking for lesions, nodules, edema, or erythema. The lid margins are firm, and I'm looking for edema, erythema, lesions, drooping of the lid, which suggests cranial nerve 3 abnormality. Looking for inversion or eversion. Paul's eyelashes are dark brown in color. It is outward pointing and evenly distributed. I'm looking for edema. I'm looking for inversion. I'm looking for eversion or thinning of the lashes. Looking now at the palpebral conjunctiva, what I'm going to do is pull down on Paul's lower lid. I'm looking for injections, lesions, or erythema. I'm going to pull up on the upper lid. I'm looking for injections, lesions, or erythema. If I observe any abnormalities at this point, I will conduct a more thorough evaluation of the eyes, including evaluation of cranial nerve 2 and 3, namely the optic and the oculomotor nerves. Moving now to the ears, I will inspect the ears, observing for any abnormalities. Okay. I will palpate the mastoid area, which is located behind Paul's ears. Is this tender? Okay. Any tenderness in the mastoid area may suggest mastoiditis. And I'm conducting this evaluation because most of patients with acute sinusitis complains of ear pain or fullness. What I'm going to do now is inspect the outer canal. I'm going to pull the auricle up, back, and out. Observing the outer canal, I'm looking for any lesions, erythema or edema. Moving now to the tympanic membrane. Normally, the tympanic membrane is pearly gray and shiny. I can see the malleus, and I can see the cone of light on the right ear at the 5 o'clock. Paul, I'm going to ask you to close your mouth, hold your nose. Can you hold your nose, Paul? And blow. I'm observing if the tympanic membrane moves back and forth because immobility of the tympanic membrane may suggest acute otitis media. Okay. What I'm going to do now is move and inspect the left ear. The same way is I will inspect the outer canal, looking for, move back the auricle up, back, and out, observing for any lesions, erythema or edema. Moving now to the tympanic membrane. Normally it is pearly gray and shiny. I can see the malleus. I can see the cone of light at the 7 o'clock on the left ear. Looking for any lesions, edema or erythema, any perforations or retractions of the tympanic membrane. I'm going to ask Paul again to close his mouth, hold your nose, and blow. Okay, I can see the tympanic membrane moves back and forth. Moving on now to the physical exam of the nose and the sinuses. I'm going to ask Paul to tilt his head back slightly. I'm looking for cloudy, discolored, and purulent discharge, looking for lesions, edema, and erythema. I'm looking for a swollen septal mucosa, and I can only see the lower and the middle turbinates. I'm looking for a swollen turbinates. It's also very important that I palpate the sinuses for any tenderness or pain. Located just above Paul's eyebrow is the frontal sinuses. Paul, is this tender when I touch it? Okay. The ethmoid sinuses, which is located at the side of Paul's nose, is this tender?
Yes.
Located underneath his cheeks is the maxillary sinus. Is this tender, Paul, when I touch it?
Yeah, a little bit, yes.
Okay. Now, another technique that can help you find out if there's fluid or drainage in the sinuses is what we call transillumination. Okay, it is done in a darkened room, but for the sake of this video, we won't do it in a darkened room. And also, transillumination is helpful if this is done correctly. What I will do to check if there's a drainage in the frontal sinuses is I'm going to place my lighted otoscope just underneath Paul's eyebrow, okay? And if there is no fluid or drainage in the frontal sinuses, the area above Paul's eyebrow will glow or transilluminate. That's how I know that the frontal sinus is patent. Now, to check if there is a drainage in the maxillary sinus is I'm going to ask Paul to open his mouth wide open. Okay, thank you. Now what I'll do is I'll place my otoscope on the area just over where the maxillary sinuses, and if there is no drainage, the area where I have my otoscope will glow or transilluminate. Wider, Paul. Okay. I have my otoscope as a source of light and also a tongue blade. What I'm going to do now is look at the oral mucosa for any abnormalities. Paul, please say ah. Okay, I'm looking for any overlying, for any edema, erythema, coating, lesions, or masses. Okay, I'm looking now at the carotids bilaterally, looking for any overlying edema. I'm looking for any excessive redness, masses, or nodules. Uvula rises symmetrically with phonation. If it doesn't, it may suggest cranial nerve 9 and 10 abnormality, namely glossopharyngeal and vagus nerve abnormalities. Okay, I'm looking now at the posterior pharynx, looking for any excessive redness, exudates, edema or erythema. Okay, I can see the palatine tonsils. It's present bilaterally. I'm also looking for any edema, erythema, or any exudates. I can see the anterior and posterior pillars. I'm also looking for excessive redness, any exudates, edema or erythema. Okay. It is also very important to note that patients who complain of acute sinusitis sometimes complains of maxillary dental pain. This is because the roots of the teeth is close to the maxillary floor. So what I'm going to do is I'm going to ask Paul to open his mouth. Okay, I will touch his teeth a little. Paul, does that hurt? Can I touch it?
A little bit.
Okay. I will also examine the neck. It is also very important to examine the lymph nodes in the neck because this serves as drainage tract that may come from the face, the sinuses, the throat, and the mouth. Okay. The anterior cervical lymph nodes, just right here. Okay. This may be inflamed if a patient has acute tonsillitis. Okay. The posterior lymph nodes, which may be inflamed if a patient has mononucleosis. And the occipital lymph node, located here, which may be inflamed if a person has injury at the back of the neck. And also the submental lymph node, which is located just underneath the chin of Paul, which may be inflamed if one has mouth infection. Okay. This concludes the examination of acute sinusitis.